Like, I didn't have resources. I didn't have hospital beds. I didn't have PPE. I didn't have counseling referrals to give to people in mental health crises. I just felt like I kept saying, no, no, I'm sorry. No, I'm sorry. And that was crushing for me because, again, that's not what I'm there to do. And that's not what anybody wants to receive.
Hey there! Welcome to Let's Make a Health Connection. In this podcast, we introduce, interview, and showcase the many healthcare providers and resources that we feature on our website, localhealthconnect.com. I'm Jennifer Barber, and I'm a licensed clinical social worker in Washington and Oregon, and I'm happy to be part of the Local Health Connect provider community. Today we're talking to Amy Ponteri and Heather Sweeney. Amy is a licensed professional counselor in Oregon and a nationally board-certified art therapist. She has a private practice in Southeast Portland, and in addition to private practice for the last 16 years, up until this past spring, Amy worked in an emergency department providing mental health crisis evaluations and interventions. During COVID, she was struck with the lack of meaningful acknowledgement and support by the healthcare system for frontline workers, particularly nurses and aides who were literally risking their lives to be a safety net for a community in lockdown. She began drawing her colleagues' portraits to honor their work, a few of which can be seen on the Local Health Connect website. And since leaving the ER, she's collaborated with former ER colleague Heather Sweeney to create a fun and energizing program to support healthcare workers and to turn burnout around. And we're going to talk a little more about burnout here in just a moment. And I want to introduce Heather. Heather Sweeney, thank you for being here today. Heather has been a bedside nurse who currently works in the post-anesthesia unit, or the PACU. She worked in the ED and ICU for 20 years, including when COVID hit. She has her master's in nursing, and in addition to direct care, has also managed in a variety of settings, including primary care and urgent care clinics. In her words, the last 3 years broke me. Heather, that's powerful.
That's for sure.
And I'd like to turn that over to you because I think there may be more to say about that.
Well, thank you so much for having me. I really appreciate it, Jennifer. The last 3 years have been really, really hard. And so when Amy came to me to talk about this project, it struck me as something powerful that I needed for myself as well as for all of my peers. Because everywhere I looked, nurses, techs, people were just falling out of the profession. And I knew if we were going to continue on, we were going to have to try and save each other and save it so that we can continue on.
Absolutely.
It was just personally and professionally just so challenging for me to be in the emergency room during this pandemic. And I think the only way to move forward is to find ways to connect with other people and address the burnout before it gets to the point where you can't continue.
So you were a nurse in the emergency department during COVID.
Correct.
Can you speak a little bit about your own personal experience, if you're comfortable with what that felt?
Of course, I'd be happy to. It was hard. It was really hard. There was so much confusion and chaos and unknowing. And there were times when we didn't have enough PPE. You'd have to be wearing the same gown for 10 hours, just wiping your gown down. You weren't able to really be able to stop and address what was going on. People were like, you should go in the COVID area because you don't have kids. I have kids. I can't go in there. There was just a lot of back and forth where we were just really at a loss and we were not supporting each other the way we should. Working in emergency medicine is hard enough as it is. You're in the code room coding somebody's grandma, then they die. And 2 minutes later, you have to go into the room next door and blow up a balloon and treat a kid with racemic epi and try and entertain a 4-year-old while you never got a chance to really deal with the trauma of losing the person in the room next door. So years of emergency medicine have prepared us for how hard this can be. But the pandemic on top of it was it was overwhelming.
Mm-hmm. Yeah, I hear this over and over in my own practice as I'm working with medical professionals and doing groups with medical professionals. Sometimes it's been said, I was trained, but I don't know that I was trained for this,
Right.
right? This is just something so much bigger. And you all have done an amazing, amazing job. I just want to ask, Amy, do you want to speak a little bit about what you would define as burnout and maybe what you've even experienced yourself? Because as I understand it, this program that you're creating is really touching on that as the theme, right? Connecting with people who are experiencing burnout.
Mm-hmm. Yeah, absolutely. Um, Burnout is a really big umbrella term, and I think that it encompasses a lot of different things, but particularly during this time of COVID, it's really, as a term in itself, been pushed up to the surface, and I think a lot of people recognize it now. Um, Specifically, burnout refers to um, more demand than capacity. So the continual and cumulative need that outstrips the resources. So, like Heather was speaking to, that's always been a part of emergency medicine. But during COVID, that was just pushed to the brink. Burnout refers to institutional and systemic stress. So within burnout, there's also what's called compassion fatigue, which is when caregivers are repeatedly exposed to the stress of caregiving or to another person's trauma, whereas burnout is more about the system. So, like the emergency department not having enough PPE or constantly telling us to do things differently. Today we're doing it this way. Oh, nope, that's not the case. Today we're doing it this way. That is about burnout. And then I'll just speak to one other piece of this that I think is gaining some traction and really was a new term for me. In all the time of doing this, which is moral injury. Moral injury is a term that speaks to when your sense of right and wrong is challenged. We come into this world like moral creatures, conscientious, particularly in a helper profession or as caregivers. We really want to do the right thing and help people. And when we can't do that, or when systems are actually working against us doing that, and we have to make a choice to stay true to ourselves and our conscience or go with the system, we're injured. That is what's called moral injury. And, even not having enough PPE, right? There was such a fear of, as providers, not only just catching it ourselves, taking it home to our families, but, bedside nurses had to worry about catching it and giving it to other patients.
Right.
Right. That goes against what, anybody is there to do. They're there to help, to heal, to think about, passing on an illness that nobody knows what it is or how it's treated. It's terrifying.
Yeah, absolutely. And I just want to ask this question. Maybe we can expand a little more, and whoever wants to speak to it, either your own personal experience or what you've seen in your coworkers. But what does it look like when a healthcare professional is burning out?
Mm-hmm. I think it can take so many different forms. You can imagine that if you're there to help and there's never an end to the demand, you begin to feel pretty powerless, that what you're doing isn't making a difference. At the far end of that, you might even feel like um, you're harming other people, in terms of like if I'm passing on this COVID, that you might be harming other people. It's really kind of um, like the Sunday dreads. I say Sunday, thinking about a Monday work start. But that sense of dread that you might feel thinking about going to work the next day or as you're driving to work, just feeling like you're going to be put in a position where you really can't affect things the way you want to or positively. I'll just say this. There got to be a point during COVID when everything was so stacked. I think it really began to affect me in that I felt like I was just there saying no to everybody. Like I didn't have resources. I didn't have hospital beds. I didn't have PPE. I didn't have counseling referrals to give to people in mental health crises. I just felt like I kept saying no, I'm sorry, no, I'm sorry. And that was crushing for me because, again, that's not what I'm there to do. And that's not what anybody wants to receive.
Yeah. Heather, I wonder if you might speak a little bit about what you would see around you that might have said, oh, wow, there is burnout going on all around me. I mean, maybe like increase in substance abuse, alcohol use, sleeplessness, those kinds of things.
For me, from my own perspective, burnout really was when I was empty. My bucket was empty. I didn't feel like I had anything left to give to my children, to my marriage, to my patients. And that's when I decided to leave the emergency room and go to the PACU, which is a retirement job. It's not a place where you go where you feel like you are. I love emergency medicine, and if I could stay there and sustain it, I would go back in a heartbeat. But for my own mental health, I needed to step away. And when I did step away, that's when I realized that was my burnout moment. I wasn't giving my patients what I wanted. I would go home at the end of the day and be like, I should have and could have done this, this, and this. There just weren't enough nurses. There wasn't enough time. There weren't enough resources. I couldn't do these things that I wanted to do to give my patients what I felt like was the right thing to do. And so where I'm at in the PACU, I'm able to do that. And that's really revitalized my love of nursing and knowing that I can give great care. And then it's also given me an opportunity in my personal life to step back and look. And now I'm divorced. I've realized I deserve different things in my relationship. I'm able to be way more present for my children. And I'm rebuilding myself as a person, which was really hard to do when you're just giving constantly and not feeling like you're getting anything in return other than angry patients that you can't meet their demands or their needs. I feel like the term quiet quitting has really come around recently. And I think a lot of people are quietly quitting in their professions as healthcare providers because we've all been stretched so thin, we don't have anything left to give. And so I didn't want to quietly quit. So I moved roles where I was able to still feel like I could do what I wanted to do. I have seen tremendous burnout in my colleagues in the ICU and the ER. And like you said, there's tremendous vices that people turn to, substance abuse, a lot of unhealthy behaviors that people are just in denial because if they start to think about all the trauma that they're dealing with, you can't go back. Just like Amy was saying, you get those Monday morning dreads and you get that pit in your stomach and it's like, I don't know if I can do it and go back. And so that's why this was so exciting talking with Amy about this project of finding ways to give people tools to rebuild so that they have tools of ways that even if it's just a couple minutes to find a way to find your center again and kind of find a touchstone that reminds you of why you got into what you're doing.
Heather, I'm so glad that you had an option to get out of the emergency department and use your skills and your passion and your heart in a different environment. You know, I think that there are some people that are thinking, or sometimes it happens that, you know, I need to get out, I need to do something different, but they don't always have that within their career. within their skill set, within their education, to be able to but to move and still use those, right? And so I'm
Yeah.
so happy for you that you had the opportunity to do that.
I feel blessed to have that. I have a lot of coworkers that have left to go run food trucks or
Yes.
something that is not in the industry, and I understand completely why. Some days it feels like I want to go sell hammers at Home Depot,
Yes.
but I know that my calling is in healthcare, and finding a way to sort of take a step right or left, but not leave the industry. I feel really lucky that I have that opportunity. And I think people should look at that so that you don't completely get to the point of breaking and moving on to not staying in healthcare.
So, what gets in the way of addressing burnout?
I think you just spoke to that so well, Heather, in so many different ways. And I think really one of the biggest pieces is that this is not talked about in the actual setting. You know, Heather, you were talking about going from, you know, the code directly next door to, you know, treat an allergic reaction, you know, and, you know, by the end of your 12-hour shift, you have made so many pivots that to even go back to 8 a.m., it's like a world away. And so there is just not time or space or the culture to actually stop and reflect on what you have been holding and moving through the day working with, let alone to notice your own emotion or your own body. I mean, there were times when I would go 12 hours and realize I hadn't even gone to the bathroom once. You know, so to even pause and think, oh my gosh, I'm getting pretty stressed. And then you go home and you can't really talk about it with your family or your loved ones. And so there's just not a place that supports it. The other thing, sort of a byproduct of there not being a place to support it, is that you start to think it's you. That if I'm really struggling with this, or if I'm stressed out, I don't hear anyone else talking about it. I might hear them venting, right? I might hear them venting about, you know, the patient in 24, or, you know, venting about the lack of PPE, but I don't hear them grieving. I don't hear them talking about being afraid. And so you begin to think that it's you, that you're not cut out for this, or that, you know, you must be extra sensitive, or, gosh, you just don't have what it takes to do this. And which just creates more stuffing, more denial, more, you know, I'm definitely not going to talk about this. And that's when it starts to come out sideways, you know, drinking too much, or, you know, not talking about it, not feeling, not giving yourself space in other areas of life.
Right. Disconnecting away from life.
Yes.
Amy, I feel like talking about the culture is a really big deal. I have seen a slight shift recently as burnout has become more of a popular conversation, and quiet quitting, or these kind of words, or just seeing our peers disappear from departments, that we finally are starting to have those conversations about how are we going to heal our healers so that we can all continue on. And the more I talk about the project you and I are working on with my peers, everybody's like, please, I need this. We definitely, you're not alone. We all feel like that. And so finding that connectedness so that you don't feel like it's unacceptable or it's culturally inappropriate to feel like you have to have your armor on all the time, because we are expert stuffers. Yeah. And, you know, that armor is important so that you can go from the code to taking care of somebody who has a kidney stone. But you also need to, at some point, let that armor down so that you aren't constantly just not feeling anymore.
Yeah.
So we're definitely going to talk about this program, and I'll leave it up to you however you want to segue into it. I just know that there are a couple of more questions, and maybe those questions will be answered as we begin to talk about the program that you're creating. But I would really like to talk or make sure that we address, like, when a person recognizes the signs of burnout, what can they do to address it? And then also just being able to talk a bit about the role of connecting with others and how that is so important when we're addressing the culture, like we brought up, or addressing watching each other burn out, and how can we keep each other from doing that.
So there's not one approach to beginning to address burnout. It's a bit like saying, how do you begin to address, depression or PTSD? It's sort of multifaceted, but there are, things to do to begin to look at in the short term, which essentially is anything that's good for your body is going to be good to begin to address burnout. So, oftentimes you hear, oh, self-care, like a night of indulgence, like, oh, take a bubble bath or do your nails or, make a spa appointment. That is an event. But what we really need to shift to in this culture is thinking about this as a practice. A discipline, that it's not something that you come to when you're just in a crisis or you're really feeling it, but it's something that you are touching into daily. So, everything from, eating well, sleeping well, being mindful of, the substances that you're using, moving your body. And I know that these things, like I said, sometimes I'd get to the end of a shift and I hadn't even gone pee in 12 hours. But then that's a cue, like, well, I'm definitely not going to leave here and go eat a bunch of junk food and have a few drinks. Like, I need to care for my body. I need to recalibrate it. So there's that piece in the short term, just really taking care of our physical being. Then there are longer term pieces where, reconnecting to why did we get into this in the first place? Burnout, compassion, fatigue, moral injury, like Heather, like you were saying, like your tank is empty. You feel like you have nothing to give. And that disconnects us from why we're even doing this. So returning to why did we get into this in the first place, and what actually brings me joy about this? Is it talking to the patient? Is it finding a moment of connection? Maybe I was able to find a referral. Maybe I was able to have a conversation where something was understood. Like, those are real pieces that can happen and are within my agency. The other piece too is just noticing our own nervous system, right? Like, when we're running from thing to thing, we're not having time to pee. Oftentimes that doesn't even get noticed. Like, we know we've been busy, but actually attuning to, like, what is happening for me? Oh my gosh, I'm really tired. Or, wow, I've just really been running all day. And then not letting that drop at the end, but really attuning to what we have just been through and, the toll that it has taken. So attuning to our nervous systems, going back to our values, taking care of our bodies as a discipline.
Great. What about this role of connecting with others? It seems like this is a really big piece.
Yeah. One of the things that was so fascinating to me, or not fascinating, I guess I'd say more disappointing, during COVID was how we were all having this collective experience. There was not a space to talk about it. So again, like venting was happening, but we weren't talking about what was happening for ourselves. And then, the system would say, we really see your sacrifices. If you're struggling, here's the call map. Mm-hmm. Here's EAP. But those were things that kept it on the individual.
Right.
If you are struggling, and it's easy to think, well, I don't hear anyone else talking about struggling, so I must be the only one. And then it was like, go do it on your phone, or go talk to someone one-on-one. It kept it isolated.
Right.
Which keeps it stigmatized, which keeps it down and does not normalize this part that caregiving as a profession is really hard work. And we as caring, conscientious people are going to feel the effects of that. And so connecting with other people around that is critical for healing. Yeah. I mean, if you think about trauma work and healing isn't done in isolation. It's done in connection when we can utilize the supports and the energy and the resources that others bring to the space. Great. And so connecting is key. And that's definitely something that Heather and I are planning into our program, which is about really connecting in a common space, making sure that it is normalized and that there is a space to talk about it as opposed to it just being one-on-one.
So let's dive into that a little bit. Tell everybody what it is that you are you in the process of creating, or is this created and being utilized at this point?
We are in the process of creating it.
Okay, tell us about it.
Yes, so it is called Rooted. And Rooted refers to the place of rooting in your values, rooting in your community, rooting into your nervous system. And it is going to be a sequential series, workshop series, where people could either attend online, and we'll have an in-person component. And it is a place for people to come and both get information about, how do you begin to tap into your nervous system to see what's going on? How do I reconnect with what I'm passionate about? As well as to have the support and to provide support to peers and colleagues who are also going through and experiencing the same things.
And is this specifically for medical professionals in hospital settings, or is this in the community? Talk about how people might find this program and know that this is for them.
So this is for any healthcare professional.
Okay.
It could be inpatient, outpatient, hospital setting, folks who are in healthcare, anyone from, nurse, aide, physician, unit secretaries, people are exposed to the system, to the trauma, to the demands. Yes. So, everyone is welcome to participate. And we're going to be offering continuing ed credits for folks who want or need them. But even without continuing ed, our hope is that it is a place of connection and renewal. That it's actually not just like going to a training, but that it's fun, and that it's energizing.
So Heather, maybe you can speak a little more. When Amy says sequential, are we talking about once a month, once a season? What does that schedule look like?
We're, we're still developing how frequently this is going to need to occur to continue people growing, but you got to give people time to sort of reflect on what they're learning in each moment. I feel like weekly would be way too often. Probably monthly is more along the lines, just because everyone is so time crunched these days. But we're still sort of going to feel that out and see how what people really need, and try and be flexible and adjust accordingly, because everybody's in different places where they're at and what they're able to give, or what they're willing to even take a mirror and look inside and see where they're at and where they need to go. I really don't think that we can say this is cookie cutter for everybody. And so that's why my gut is saying once a month, maybe once every 3 weeks, but we're still ironing that out.
And this could be via virtual and also in person. So both of those things happening at the same time, or maybe a cohort that's a virtual cohort and then a cohort that's in person.
Exactly. Okay. Yeah. Specific cohorts, one online and one in person. We wanted to have a flexible approach because, like Heather just mentioned, people are in different places, and we knew that there would be people who wanted to come in person and those who would prefer to stay at home.
Love it. Okay, so I want to ask questions like, how might people get a hold of you? Where is this going to take place? But it sounds like maybe we're a little early, and maybe once this actually starts happening, we have you come back with all of that information and really get it out to people. That would be wonderful.
That sounds awesome.
Yes.
Yes,
we're hoping for. I think we're hoping to launch something in the spring.
Okay. And is this going to? I don't know if you figured this piece out yet, but is this going to cost someone?
Yeah, there will be a fee.
Okay.
Yeah, but hopefully, I mean, a lot of folks in healthcare systems, particularly when there are continuing ed credits, have education funds through their organizations that can be utilized. So our hope is that folks can make use of that. And that's actually something that came up, that a lot of folks don't even realize that they have those funds available to them. And if they do, a lot of folks don't utilize them for themselves. And so actually, using their ed dollars to do something fun and energizing would be its own way of caring for themselves and investing in themselves.
Perfect.
I think one thing, I just want to say something too that comes up for me as we talk about this program, is that Heather and I both really recognize that there are huge system issues that create and perpetuate burnout. And part of the stigma around burnout is that a person doesn't have the chops, that they just need to work harder so they can meet the demands. And so by creating this program, by no means are we saying, people need to work harder so then they can go back in their systems. What we recognize is that systems move at a glacial pace in terms of change. And people are burning out left and right. And, it's about providing support for themselves as a person, so they can be in the system, if that's where they choose to be, and can evaluate the impact on them, and if there are ways to adjust, to endure and persevere, or like Heather said, go run a food truck where they can align with their values. So it's definitely not about working harder. It's about noticing how you're working.
Yes. Thank you too so much for going through everything that you've gone through, for seeing the need and beginning to create this thing to address this need. I'm excited for you. Thank you so, so much. And thank you for coming on today. And let's just plan in the spring around launching, or maybe after your first few groups, we have you come back and tell us a little bit about how it's going.
That would be fantastic.
All right.
We would love that. Thank you so much.
Thank
for
you,
having us,
Heather.
Jennifer.
Thank you, Amy.
Thank you, Jennifer.
Thanks again for listening to Let's Make a Health Connection. Find us online at localhealthconnect.com, as well as Facebook, Instagram, and Twitter. Links and show notes for this interview are available on our podcast page. These interviews are really fun, and I hope you made a health connection today. We'll talk again next time.
Let's Make a Health Connection, copyright 2022, all rights reserved, is the exclusive property of MBS Therapy, LLC, a Washington-based company. Local Health Connect is inclusive and does not endorse any political or religious group. Thank you again for listening, and we'll see you next time on localhealthconnect.com.